Members of the COVID-19 National Command Council have been addressing a conference in Pretoria. They will clarify the number of fatalities, which this morning were initially reported at 2, but now appears to have been reduced to 1. The other person may have died from other causes. Well, Defence Minister Nombuso Malinga said she'd noted a lack of social distancing in parts of Gauteng she visited, particularly in Alexandra, a densely populated township north of Joburg. She said troops would be deployed there. Police Minister Becky Ele said there'd been 172 roadblocks around the country with 24,000 law enforcers deployed.
People that were breaking the law, the very regulations, the liquor laws, last night 55 of them were arrested. 2 Free State were arrested 5, Gauteng were arrested 20, 6 of them from Alex and 14 from the rest of Gauteng. KZN were arrested 7 from the suburb called Montle. Limpopo were arrested 10, Northwest were arrested 11, and Western Cape were arrested 2. These people are people that don't have a good will, are people that are doing exactly what they were told not to do.
Well, day one of lockdown saw many South Africans out and about instead of staying indoors as directed by government. Let's speak to a psychologist. A lot of stress around the lockdown as well. Nombuso Malinga joins me now via Skype. Nombuso, thank you very much. Firstly, why do you think it's so hard for people to come to terms with this concept of lockdown?
Good evening. It's very hard for people to come to terms with this lockdown because there's mass information that's coming in that people have to actually take in. So they need to actually take this in. They need to understand what's going on, but it's too much for them. A lot of people are overwhelmed. They're actually worried about what will happen to them. They're worried about the ramifications of COVID-19. So it's causing a lot of problems and people have started to panic. There's a lot of fear. There's a lot of people are very terrified right now.
Yeah, and we were talking about this earlier. It's also because it's an invisible threat. You can't see it, you can't touch it, but it's there.
Yes.
That must have psychological implications.
It has psychological implications. People have been told to stay home. It's good for everyone. It's good for our own safety to stay home, but it's very hard for people to grapple and truly understand what this means. And this is why we're seeing all these behavioral problems that are happening right now. People aren't really sticking to the plan as to what they should and shouldn't be doing because it's all the contradictory information, and also people not taking it seriously enough with social media, making jokes and everything that's happening.
Yeah. So how does that change? Does it come through government being stronger, or society sort of policing, people policing each other? How could it change?
People need to police each other, but we also have a social responsibility. It's not only on government. It doesn't only rely on government. We need to listen more. We need to hear more what the media is telling us, what other people are telling us around us. Well, as long as it's not the wrong information, we need to take all of that in and actually digest what's being told to us, because the most important part is for everyone to really, really try to keep safe and to do their part in actually not putting others at risk and to actually try and curb this. So it's very important for us to hear what's being said on the news, what government is saying, and not to take it as punishment that, oh, now they don't want us to be out there, they don't want us to continue living our lives. Yeah. We should really think of it as everyone's worrying about our well-being as society.
Well, what message do you have to people who are feeling that fear? Some can afford to stay home, others have real economic concerns, and then everybody's got the health concern as well.
Yes, yes. What I would say right now to people, the biggest message we can send across is that people need to stay safe. They need to try and stay calm. They need to calm down. It's very difficult during these times, especially because if you look at low-income households in South Africa, they have limited supplies, they have limited resources. So it's very hard for them to really figure out how they will get by. So anxiety increases a lot. There's a lot of fear. There's a lot of worry, even in terms of how to comply with the rules and the guidelines that have been stipulated, considering what they can and they can't do. What people can make use of, and I'm hoping perhaps that maybe there will be more COVID lines that will be established so that people can actually have access to mental health and wellness services, so that we limit the face-to-face contact. People can actually make a call. If they have resources to Skype and Zoom, they can use that, or just pick up a call and talk on the hotline to someone who will actually be there to support them, to answer any questions that might actually be raising more fears and anxiety and concerns within them. So I'm really hoping that there will be that offered to people.
Yeah, and I guess it's worth saying that there is a South African SADAG depression and anxiety group offering support. There is some support at the moment. I've heard of something called pre-traumatic stress rather than post-traumatic stress. Do you think this is something, the anticipation of getting COVID-19, especially as the first death at least is confirmed in South Africa, this is a real anxiety for South Africans, for the world?
There definitely is pre-anxiety, but I don't even know if we should say we're at the pre-phase now, because people are really in it, and it's building, it's mounting quite quicker now. Now we've heard that there has been deaths. People are now, it's become quite real for people now. It's happening now, and there is definitely an existing trauma that's coming. So it is the way you're terming it, actually correct in that sense, and it will possibly then develop to post-traumatic, or people who may have post-traumatic symptoms after lockdown and after the pandemic has actually simmered down a bit.
All right, a huge concern. Thank you very much. Nombuso Malinga is a psychologist.